Welcome back to Power Play. How close are the premiers and the federal government to finally striking a health deal? Premiers like Scott Moe, as you heard there, think a deal is close. But also today, Federal Health Minister Jean-Yves Duclos seemed to offer a bit of a reality check that there could be a lot more work to do. What's behind that back and forth? Let's dig into it. With the front bench joining me this evening, former New Brunswick Premier Brian Gallant. He's now the CEO of Space Canada. Former Deputy Conservative Leader Lisa Raitt. She's now the Vice Chair and Managing Director of Global Investment Banking at CIBC. CTV News political analyst and former NDP leader Tom Mulcair, and the Toronto Star's Queen's Park Bureau Chief Rob Benzie. Hi, everybody. Great to see you tonight. Rob, I'm going to start with you. I think it was exactly a week ago you were putting these questions to Premier Ford, and he kind of got the ball rolling, that it appeared premiers were starting to fall in line. What is your sense from your conversations behind the scenes of how close a deal really is?
Well, Vassy, I think what Premier Ford told us last week, after I promised on the show that I would ask him about it, I made good on my promise, so I'm not a politician. He said, look, we can live with strings attached to federal funding, to new federal funding, because they all want the same things. They want better health collection, better data collection. They want a better look at what metrics are. They want better look at outcomes. They want more money for mental health. I think the provinces and the federal government are very close on what they aim to do with this new money. I think there will be, for sure, as the Prime Minister said today, some tinkering, because there seems to be a problem more in Alberta than in any other province. But Danielle Smith has an election to fight, so she needs to posture against the federal government. Doug Ford just won an election 6 months ago here in Ontario. He doesn't need to have a fight with Justin Trudeau. In fact, he was appreciative of Mr. Trudeau yesterday not poo-pooing his reforms, which are not that radical, despite what Mr. Singh was telling you earlier. So I think they're much more simpatico, Vassy, the Premier of Ontario and the Prime Minister of Canada.
Right, and we'll get to the comments from Mr. Singh in our next segment. But Brian, look, you've sat around the table in these types of negotiations. I constantly talk about it on the show because 2 months ago when I was interviewing premiers, they were like, no way, we're not agreeing to this stuff at all. We don't want strings. And things have really changed. Like, they've actually tangibly changed. In all the interviews I've done with them over the past week, they're openly saying we're close, we're okay with the stuff that the feds want. What do you think is happening behind the scenes?
Yeah, and if you add to the history that you gave, I think when we look back in November, I believe it was, when Minister Duclos actually went into meeting with the other health ministers on the provincial level and territorial level, and he thought that there might be real progress at that meeting, but unfortunately he felt that what had been talked about behind the scenes was not ending up being what the meeting was going to be about, and what the messaging, more importantly from his perspective, would be about after he went and talked to media. So if you take that starting point, that means that Minister Duclos thought that even then in November there was some headway, and it seemed to be there's some agreements, as Robert pointed out, that the provinces could get on board with some of the metrics that the federal government would want the provinces to measure and do a better job of collaborating and working on. And then we see obviously a bit of a fallout there. The premiers kind of came in and went a little more hardline. So for whatever reason, if they thought that was the right tactic, I mean, there's a thing I think around the table that I can attest to, that there really is this sort of dynamic of how strong are we going to be. So sometimes they may actually go a little over the top because they so want to demonstrate that all 13 premiers are on the same side. So there may be a little bit of over the top. Especially when you consider just a month later, they're all sort of softened up, and yeah, we're pretty close, right? And it's not like they all worked over the holidays on this, I'm sure. So really, I think we find ourselves with the history of November. There was probably some headway then. The premiers really wanted to be hardline to try to get as much as they could. It seems to me like there's a pretty clear agreement in principle, or a very close agreement at the moment. The Prime Minister wouldn't have said he's optimistic if that wasn't the case. And I think Duclos is the only one that put a little bit of cold water, just because of his experience most likely in Vancouver in November, where he felt a little slighted with the backroom talks not matching the messaging to media from the provincial counterparts.
Lisa, I spoke with Intergovernmental Affairs Minister Dominic LeBlanc earlier on the program, and I tried to get him to tell us exactly what the feds were coming to the table with, because the ask, I mean, great that there's a deal seemingly imminent, but the ask is a big one, right? It's for a big increase to the escalator, amounting to about $28 billion a year. He would not go into specifics. I tried many times, but do you think that the feds will be somewhere in and around there? Like, is that plausible?
I think the feds have calculated and made a political assessment And that political assessment is that there's going to be nothing good about arguing over healthcare and how much money is flowing in whatever direction, because people have just had it. They're concerned about getting access to hospitals. They're concerned about whether or not their emergency rooms are okay, if their children's hospitals are okay. Picking at each other on this topic is not going to render anyone ahead in the polls. And I think that that's the hard look they took at over Christmas. May not have been about thinking about their negotiated positions, but certainly they probably took a look at whether or not politically this is a fight anybody really wants to have in this country. And cooler heads may be prevailing, and we'll see where they all end up. Maybe the premier in Alberta wants to pick a fight because she has a very real election coming up. But the rest of them, I don't sense that anybody wants to have this kind of discussion, because what people care about are the outcomes at the end of the day. And outcomes for them is access to an emergency room when you need it, and good care when you also need it for yourself and your loved ones. And arguing about money is not going to be a winner for any political party.
Tom, do you think, because of what Lisa just outlined in the sort of reading the room, the public sentiment, that the likelihood of the federal government going province to province in a bilateral arrangement like we saw back in 2018 has lessened? Like, do you think this ends up being a package deal, save and except the possibility of Alberta?
I think it is going to be a package deal. And when you've got the two largest provinces, Ontario and Quebec, on board, François Legault was already being attacked last week for going along with the idea of providing more information and taking some strings that would be attached to that money. The two separatist parties, Québec solidaire and the Parti québécois in the Quebec National Assembly, were attacking him for letting down the side, for throwing in the towel, for being so weak in the face of Ottawa. And Legault's a pragmatist. He knows that the public is, as Lisa correctly says, just fed up. And in Montreal, we got this massive emergency ward, the largest in the province, one of the largest in the country actually, shut down because they just can't make it work. The public wants nothing to do with debates over jurisdiction and competence. They want a result. And the feds are saying, okay, we're going to start ponying up some of the cash that we said had to be there from the beginning. Here's how we're going to do it. And it seems that there's a meeting of the minds with Trudeau and those key premiers. With regard to Duclos, we can find all sorts of reasons. I did sense that Trudeau was feeling obliged to put a bit of the toothpaste back in the tube from Duclos' statements today, but good cop, bad cop is a nice way of negotiating sometimes. The important thing, in my view, Vassy, is that Canadians want a result, and there are several adults in the room right now, including Doug Ford and François Legault, saying, okay, we're going to play along, and I think that's a good bit of information for everybody across the country.